Welcome to this episode of Patient Perspectives in HIV, a CE podcast series. If you are seeking continuing education credit, please review the front matter for disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practicepointcme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. Monica Gandhi and her patient, a transgender woman who has been living with HIV for many years. Thank you for your attention. The podcast will now begin.
Hey, Seville, it's nice to see you or hear you on the phone today.
Yes, same here.
My name is Dr. Monica Gandhi, and I have known Seville since 2015 when one of our providers was leaving in the clinic and she transferred her care to me. And it's really been my privilege and honor to be your doctor. And I really wanted to just ask you some questions, that I've often asked you with students, but to really explain with this audience that when did you first learn about when you were diagnosed as having HIV?
When I first found out that I was HIV positive was in 96. At that time, they were doing a lot of studies out here for people that was LGBT and Q that were negative. And for about maybe 2 years, I was participating in the studies. And this last study that I had did was a very good paid study for people that was negative. But when I went back to get the other half of my payment, the girl told me, she gave me my payment and told me, she said, Seville, can I tell you something? I just want to tell you your results from the blood draw. She said, it turned out that you are HIV positive. And when she told me that, I just sat there for about 5 minutes. She asked me, was I okay? And I couldn't even really answer because I was like stuck on that. And so when I left from the place where I did the study at, I wanted to commit suicide because I just wasn't ready to accept that fact and didn't know how to really live and deal with having this that I had heard other people died from. And, 96, they didn't have the information like they do now.
It was such a shock. And you're right, 96 was such a hard time to get the diagnosis because it was before all of these antiretroviral therapies it was actually just at the cusp of it in a way. That was the year that we got these highly active antiretroviral therapies and what did feel like being given a death sentence. And I completely understand your reaction. How were your interactions with healthcare providers and when did you end up getting on HIV medication?
This is how it went for me. The next day, I went up to this agency that they used to have out here called TARP. And I was able to receive what they call a peer mentor. And a peer mentor, she took me to my first hospital that dealt with me being HIV positive was St. Mary's. At that time, they didn't ask me if I wanted medication or not. So I was just living with the virus and time went on. But St. Mary's was my health provider and they had case management for me. They had a lot of things offered to people that was HIV positive at that time. I did not get on medication until 2007 is when I made up my mind that I was going to do it.
So you were on the efavirenz and the tenofovir disoproxil fumarate and emtricitabine as a single pill. And, I think that after that, you didn't have the side effects that some people had, which was great. And I mean, a lot happened in your life that I consider you one of my favorite adherent patients, but I don't think you've ever missed a single dose of your medication, like in your entire life. And I wanted to see, what was it about you that once you started getting on antiretroviral therapy, what reminded you to take it? Was it your eventual husband? Like, how did you do this? Was it friends and family that you just, once you started it, how did you incorporate daily antiretrovirals in your life?
I had came to the point of the realization from 96, all those years up till 2007, that this is something that's going to be with me. HIV, living with this, what I had, I was able to go through counseling, therapy, support groups, meeting other people and see how they talk about their lives living with it. And I came to a conclusion that me and this thing called HIV, it's like we married to each other. There's no way that I can get rid of it. I can't drink it away. I can't smoke it away. I can't do nothing except live with it.
Yeah.
And I tried suicide. That didn't work. So what I'm going to have to do is take full responsibility of my actions first. I kept myself in therapy, and there was an organization out here called New Leaf at that time, and it had a therapist, and me and the therapist, he worked with me good, where I was able to accept the fact of living with HIV, my responsibility of how I got it, how to live with it, what did I feel about it, and how I felt today. He was real good with me. So with that there being said, and the medication was so simple for me to take, I just put in my mind that every morning when I get up, when I go to the Facebook, I know what I got to do in the morning. I mean, that's my way of how I was able to accept taking the medication.
So yes, and I think, I mean, your viral load, it's been reflected. You've never had a detectable viral load. You've always been virologically suppressed, and your CD4 count has been very high as a result, and everything has gone well in terms of your HIV, and it's really an amazing thing to see, and a pleasure to work with you on this. One other question I had is the aspect of the transgender management, which, we have kind of incorporated into our care off and on. Sometimes you'll have side effects with the transgender hormones, and sometimes we'll take them off and then we'll put them back on. And how is that figured into your care, and how has transgender management and hormone management been important to your care?
It's very important to me, taking with the medication and taking hormones or whatever. I personally have never had no terrible or bad side effects from either one. And as far as me and hormones, I'm at a size right now without having any work done, none at all.
Yeah. It's kind of, you're very responsive. Your body's very responsive. Let's say, yeah, it's good.
So I was able to grow a nice set, very lovely.
I would agree with that. It's looking good. So you're looking great. I mean, it's just, it is amazing to be your doctor. And, we ended up having to switch your HIV medications kind of midway through. We decided that the TDF, the tenofovir disoproxil fumarate, we were concerned about renal effects, which is kidney, and we were concerned about bone effects. And we ended up switching you over to dolutegravir, bacavir, and 3TC. And we had some effects on that. So tell me about how you're doing with your current regimen,
Well, because the one that I'm on right now, I'm able to, I take it around about 12 new. Matter of fact, before we had our conference call, I had already dropped the pill. So I'm good for the whole day.
Yeah. So we ended up doing dolutegravir, abacavir 3-TC, and then you had some side effects on that. So we ended up switching to bictegravir, tenofovir, alafetamide, and FTC, and you're doing fine on that.
Yes. Now, the only thing that I can say about that is that I noticed that it hasn't increased the size of the belly. If anything, it seems like my stomach is starting to drop.
Okay, so this is concern that we're getting with some of these, after everyone was doing great with their virologic suppression, now we're looking at some of the side effects of these medications. And tenofovir alafetamide, TAF, has specifically been related to weight gain, and so has the integrase inhibitors in combination with TAF, and it really is that combination. And so that's my next goal with you, is to talk about what we're going to do about that, because everything that you just said from 1996 onwards, 1996 was a horrible time to get a new diagnosis. We were on the precipice of getting these new medications. Your reaction to something that was a death sentence, understandable. Then you ended up getting a lot of support. And if you could just talk a little bit about the support from your your husband and your friends, and then I'll come back to the fact that everything you've experienced, you've done well with the medications, but now you're having side effects, and we're gonna work on those. But tell me, I kind of want to end with like something that really touches me about you and your situation is the love.
I'm gonna say like this. What has really worked for me?
Yeah.
There is tremendous. And when you have the support groups that go on, even sometimes, not sometimes, but the times when that there are studies that you qualify to participate in. Some of the questions get you to thinking. A major part of it is having a doctor that you can talk to just about anything, no matter how it comes out. You have that rapport with your doctor where you can talk about things that's going on with you. And another part that helped me with this is getting my recovery intact. Because doing drugs, trying to be on time, taking your medication does not mix. Yeah. And then you get to the part, if you are having sex, whatever type of sex it is, you're not in your right frame of mind on what you're doing. And so that consists of where either you're not using rubbers or not even letting people know that you do have it, because it's their choice then if they want to continue the engagement with you. So I think a lot of it comes with the education that is put out here. But you have to, if you have addiction, you got to get yourself together so that way you can be able to take on what you need to take on when it comes to dealing with this virus.
Yes. And I think that's another thing that I really admire about you is that you went through so much, but you also really worked with the peer support, and you yourself became a peer supporter to help people with your recovery. And so I, for me, that is something that has really been impressive about what you really pulled. You pulled yourself through a lot of things. I wanted to finish though by talking about Paul because I like him, and I like that you have support in your life, and I think it was important that you guys have been supporting each other. You're both living with HIV, you and your husband. You both went through hepatitis C treatment together, which I think was really amazing how you supported each other, and I think that's been really helpful to you to have that.
My husband that I have today is a blessing because, one, we both are living each day, taking care of ourselves and fighting. And when I say fighting, I'm not meaning as physical, but also dealing with learning and still learning, dealing with HIV, the medication, and also keeping ourselves both in recovery. Now, I've been in recovery ever since 2007, and this is 2021. So I'm working on 14 years. He's working on 13 years of clean and sober.
Yeah.
Is it easy? Is it easy? Hell no. Recovery is something that you have to work at. That's just the same way as with HIV. Every day you got to know how to take care of yourself. And even makes some people, and for me, it makes it even better because I have somebody that I can talk to. When something ain't going right or I ain't feeling right, I'm able to be able to talk to him and tell him, you know what, I think I'm going to have to give Dr. Gandhi a call or whatever because I'm not feeling right about this. It helps in the relationship when you can talk to somebody that also is living with it themselves. So it goes back and forth. You know, it'd be kind of one-sided if I am and he wasn't.
Yes, exactly.
Would I be able to get the support I need? I don't know. I can't answer that because if you're not living with something, you really don't know exactly how it is to wake up in the morning and know that you're still living with HIV, but some of the side effects, if there are any, that you have to deal with and have to go through. Or sometimes when you see changes in your body.
I think it takes that kind of support to do it, but you've done it alone. You've done it with support, and you're right. It is a constant process to live with HIV, to take the medications, to take them daily, to live with the side effects, to talk to your doctor about adjusting medications if there are side effects.
I just only want to say this too. What even helps better is when you have a doctor that can care, understand, and listen. Some of these doctors or whatever that are taking clients or whatever, I'm not saying all doctors are bad, but all doctors just don't have that and that care.
That's because I get patients like you. So I'm very lucky. Thank you so much for talking to us today. I think we learned a lot. Thank you so much.
Thank you.
Thank you for listening to this episode of Patient Perspectives in HIV. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.